Hi everyone! Today we are going to talk about what happens if your water breaks before you go into labor, and how the next steps that you choose going forward dramatically impact the way that your birth unfolds. So most of the time the water bag will break sometime during birth, especially towards the end of birth when you're getting near pushing. And some babies are born en caul, which means they're born with the water sac intact. Only 10% of the time will the water bag break before going into labor. And a lot of people believe that water bags breaking is kind of like this giant dramatic gush, and it always seems to happen in a public place. But that's actually not true. Yes, your water can break in a big gush before you go into labor. But a lot of the time, if your water bag were to break before you go into labor, it may actually just look like a small trickle that just continues to flow out of your vagina, enough to fill a pad here and there. If you go into your midwife or obstetrician, they can do a pelvic exam with a speculum, and they can look for water pooling by your cervix, and they can also take a sample of the water and look at it under a microscope to identify if it is in fact amniotic fluid. A less invasive way that you can check to see if it's amniotic fluid is by using something called nitrazine paper. The paper tests the pH of the fluid that it touches. So if you touch the nitrazine paper to your pad that has some of the fluid on it and it turns blue, that can help you identify if it is amniotic fluid. The thing is that nitrazine paper can sometimes have false positives. And if you had sperm in your body anytime in the past 24 hours or so, it's possible that that is affecting the pH of the fluid that is coming out of your body, and that can make the nitrazine paper turn blue. You don't have to confirm that your water bag is broken, and chances are if you are getting continuous fluid flowing out of your body, it's your amniotic sac. But if it's just a little bit of fluid and you're not totally sure about it, it's okay to check and see if it is amniotic fluid if that's something you're curious about. So there are two layers to the amniotic sac. There's the chorion and the amnion. Sometimes one of the layers can break and a little bit of fluid can leak out from that one layer breaking. So there have been people who have thought that their water was broken. It tested positive on a nitrazine paper, and then later through a cervical exam or the water bag breaking later, they discover that not both layers were actually ruptured. If your baby is still in one layer of the amniotic sac, they're not susceptible to infection in the way that they would be if both layers of the amniotic sac were to be ruptured. Infection risk is something that a lot of providers are really concerned about. And the reason why is because back in the 1950s, there was a really high infant mortality rate. And this was due to the fact that a lot of people didn't have the same access to testing and treatment for STIs. They didn't have the same kind of access to sanitation practices that the majority of the population in the US has today. And the mortality rate was so high among babies who were born to a mother who had the water bag broken for 24 hours or more, because of a few reasons. One of the reasons is because there was limited STI treatment and testing. Infections like gonorrhea and syphilis were much more common, and they could lead to poor outcomes for babies. Antibiotics were not widely used for group B strep or other infections, and so that led to less babies getting the help that they needed if they were exposed to that infection. Also, vaginal exams were much more frequent back then, and that introduced the baby to a lot more bacteria and increased the risk for infection. Also, in the 1950s, hospital sanitation standards were much lower than they are today. Vaginal exams were frequent and also were not performed with sterile gloves a lot of the time. Sometimes care providers didn't even wear gloves, and that significantly increased the risk of babies becoming infected. So today, things are a lot different, and based on the testing and treatments that we have for bacterial infections, for STIs, and based on the different methods for sanitization and for preventing infections by using sterile gloves, etc., we do not need to rely on the research from the 1950s to apply the real risk to today. Instead, we need to look at the research we have today to really understand what your risk of infection is when having an open bag of water. So if you're planning to birth in the hospital, it's very likely that once the water bag breaks, if you call your care provider, they will probably tell you that they want you to come into the hospital immediately for you to start Pitocin to get labor going, because they're worried about the risk for infection. And this is based on that outdated 24-hour policy. The research today shows that you have 48 to 72 hours before the baby is born without increasing the risk of infection to baby for those who meet certain criteria. And that criteria is that they don't have an active STI infection and they're negative with GBS. And you can learn more about that criteria from Evidence-Based Birth, and you can find the link below. So if your water were to break before you go into labor, there are a few different options that you can take. You can go straight into the hospital and start Pitocin or other medications to get labor going. You can stay at home and take a nap and eat a snack and hydrate, go on a walk, and then head to the hospital to start on Pitocin when you feel ready. Or you can wait at home and see if labor starts on its own and do some other natural things to try to get labor going on its own. No matter what you do, it's important that you do not put anything in your vagina, that you don't have sex, that you maintain clean vaginal hygiene by wearing clean underwear and washing your body regularly with soap as you normally would. And if you do want to try to get labor going naturally, I encourage you not to go hike up a mountain and exhaust yourself. It's important to rest too. You want to eat lots of protein, hydrate your body, and rest. And doing positions like spinning babies positions, going on walks, those things are great, but please don't exhaust yourself. So the reason why some families want to go straight to the hospital and get Pitocin is because they feel more comfortable getting the baby out sooner than later, and that's okay too. And it is also an evidence-based choice to choose to stay at home and wait until labor starts on its own. You can make a plan with your care team and say, I want to wait at home for this amount of time, and once this amount of time has passed, let's check in together and we'll make another plan. And another plan could be to wait longer, to try natural methods to encourage labor, or to try medical methods to encourage labor. If at any point you want to encourage labor to start after your water has broken, there are a few different things that you can do. Medical methods are an option and natural induction methods are an option. But mechanical methods, which are methods that involve doing something to the cervix mechanically by using a finger or another tool like Dilapan S or a Foley bulb, are not safe methods to do anymore because they can increase the risk of infection. It is ideal to avoid vaginal exams as much as possible, and if one were to be done, that it is done with a sterile glove. If you wanted to use a medication to get labor going, you will probably be recommended Pitocin. Pitocin is synthetic oxytocin, and so it stimulates contractions by stimulating the longitudinal smooth muscles of the uterus. However, there are many different components for labor to be able to unfold. One of the components is that your uterus is contracting, but another component is that the baby is putting adequate pressure on the cervix to help to stimulate contractions and encourage the cervix to soften and dilate. If the baby is in a non-optimal position, that is not putting pressure in an ideal way on the cervix, that can impact your cervical changes and that can impact your ability to go into labor or for labor to continue smoothly. It can also impact pain or the sensations you're experiencing if your baby is not in an ideal position. The thing about Pitocin is that it comes with risks and it also comes with benefits. The benefit is that it does stimulate the contractions and it can help you go into labor. The risks with Pitocin is that it does not cross the blood-brain barrier. So what that means is that when you take Pitocin into your system, the molecules are not big enough to cross the blood-brain barrier. So when your body has a naturally induced contraction, meaning that your uterus is contracting on its own without medication forcing it to contract, your body will release endorphins to match the intensity of that contraction. And in that way, your body will never give you a contraction that you can't handle because it is always met, the sensation is always met with the perfect amount of endorphins to help you cope with labor. Endorphins are your natural pain-killing chemicals. When you take Pitocin into your system, the feedback loop basically doesn't kick into gear, so you're getting the contractions without getting your body's natural pain-relieving chemicals. Pitocin can be a good tool for someone who's planning already to have an epidural, but if you're really wanting to have a normal physiologic birth without medication, Pitocin definitely can make labor more painful. So if you're wanting to avoid that side effect of labor being more painful, it may be ideal for you to look into other ways to encourage your body to go into labor or to wait. Another medication that can be used to induce labor is called misoprostol, and that can be placed inside of the vagina to help the cervix to soften and dilate. This is often used in combination with Pitocin because Pitocin doesn't cause the cervix to make changes, but it does cause the uterus to contract. So misoprostol can encourage the cervix to make changes while Pitocin is causing the uterus to contract. There are very rare but serious complications that have been reported by using misoprostol orally or vaginally, and that includes placental abruption and uterine rupture. Taking it orally would avoid an increased risk of infection by putting it in your vagina, but it is much more effective when taken vaginally. If you're wanting to use natural methods, some things that you can look into are castor oil, and I find that people have the best experiences with castor oil when they take it in something called the Midwife's brew. When you take castor oil straight into your body, it can upset your belly, it can lead to diarrhea and vomiting, and that can be really not fun. If you're vomiting persistently because you took in a lot of castor oil, that can lead to dehydration, which can be unsafe for you and your baby. So if you're interested in taking castor oil, you can look into recipes that many people have used and have found success with, and one is called the Midwife's brew because it mixes proteins and other components with the castor oil to help your body to receive it and integrate it well in the body so it doesn't upset your belly, and you're only using a very, very small amount of castor oil. Natural methods often work best when there's a combination of many of them. So that is like pumping with the breast pump on each breast for about 10 minutes on each side, and then waiting an hour and then doing it again. Doing the mile circuit or going on walks, doing spinning babies positions, resting in positions that allow the top leg to be lifted up high, like in the exaggerated side lying position from the mile circuit, and doing some emotional preparation work and emotional release. If you're feeling any emotions, allowing yourself to fully feel those emotions, listening to birth affirmation tracks, listening to things that help you to feel confident and empowered and happy and calm. Fear and emotional blocks can prevent someone from going into labor if they are causing you to feel stressed and release stress hormones, because stress hormones block oxytocin, and that is the hormone that is needed for you to go into labor. So today we talked about your water breaking before going into labor, what that looks like, and some different options and their risks and benefits so that you can explore your options and make an informed choice. Know that you can always check in with how you feel, and if your care provider makes any recommendation to you, you can look through the tool called BRAIN. What is the benefit? What is the risk? What are the alternatives? What does my intuition say? And what about doing nothing? It is so important that we go through this tool whenever we make choices, especially really important choices like how you move forward once your water breaks, because that really can impact the way that labor continues to unfold. If you're choosing from fear, which means you're feeling fear in your body, and you don't have the evidence-based information you need to make an informed choice, you may end up having a birth experience that you didn't really want to have. But by having the full information on the risks and benefits of all of the interventions that are available to you and all of the options, and knowing how to feel love in your body and choose from a place of love, it's more likely that the choices that you make will align with the intention that you have for your birth and with the experience that you're wanting to create for your baby. In the Peaceful Birth Academy, you can look through my entire birth preparation course free for 7 days. And in there, you can find a full illustration on the risks and benefits of all interventions available, how to say no thank you to the ones that you don't want, plus a full illustration on everything else that you need to know to help you feel confident and prepared for birth, whether it comes to preventing tears during birth, how to catch your own baby, how to prepare your body and mind for birth, and tools to help you cope with labor. I offer weekly coaching with me and a community of other parents. Just click the link below if you want to start your free trial, and I would love to see you over there. Thanks so much for listening, and I really hope this helps.